Hello and welcome to AMDA on the Hill, your periodic updates for AMDA's public policy and advocacy activities. My name is Alex Bardakh and I'm the Director for Public Policy and Advocacy here at AMDA. As usual now, I wanted to update you on a few things that we have been doing with our policy and advocacy activities. Clearly, the start of this year has been quite the busy one. I'm sure you all know by now the election has turned things around a little bit into how things are getting organized. But the beginning of the year is being spent kind of organizing the agendas and looking at some of the big COVID bills that have been talked about even before the end of the year. So what is going on right now? Right now, the Senate has voted, the House has voted for a COVID relief package that the Senate is deliberating. We are following this very closely. We understand that the language in the bill does contain dollars for nursing homes. In particular, it allocates dollars for the use of strike teams that have been used in various states in various capacities, such as helping with vaccine administration or other issues. There are also money allocated to the quality improvement organizations and some other things. Clearly, this is still an ongoing issue, and we don't know what the final package is going to look like. But clearly the negotiations are active and we are likely to see some form of legislation pass Congress in the next week or so. So stay tuned for that. We will of course provide you with detailed summaries and recommendations as to what actually occurred. Clearly, you know, that's just on the legislative front. There's going to be a lot of flurry of activity around the regulatory impact of this and some of the guidelines that will occur. In terms of sort of the general overview on the political side, it's clearly the one party now has control. The Democrats have control of both the House, Senate, and the White House. Of course, that majority in the Senate is very, very slim. But what this does mean is that Democrats hold control over the agenda. They hold control over the committees of jurisdiction. So they set the hearing schedule and things like that. We're likely to see hearings around COVID, and particularly in nursing homes. There have been general hearings already related to COVID-19 handling, but obviously nursing homes have been in the spotlight. Obviously, you know, the situation in New York and in other states have garnered a lot of attention. And AMDA has been contacted by various press media asking us for our positions going back to last March and what we plan moving forward. So we have been very active speaking with legislators and their staff, the media, and others who are interested in the topic. So I think this is going to be very interesting moving forward as people turn their attention to kind of analyzing where we've been and where we want to go. And of course, we will stay ahead of that and try and provide as much information out there as possible. On the administrative front, of course, what has happened is once an administration leaves, a lot of the heads of the key positions have also left. So there's a new nominee for the Department of Health and Human Services, Javier Becerra, who is a current Attorney General of California. I think his nomination was actually just recently passed out of the committee. But if you're asking yourself why is an Attorney General from California being nominated for HHS, he does have an extensive experience on the key committee and has been in leadership of the party. So he does have experience in healthcare. If you look back at you know, some of his testimony and questioning, and you know, he certainly has a lot of interest in this area. So we believe that the nomination will go through, although so far it appears to be going along party lines. Similarly, there's a new nominee for CMS. She has a history in healthcare as well, and you know, she is a former Obama administration official. This is quite typical that, you know, especially with President Biden now, who served as the vice president, he's having a lot of folks who served in the Obama administration come back in their roles in the Department of Health and Human Services. Essentially, I think what that means overall is that we will see that the Affordable Care Act, that has been under a lot of scrutiny ever probably since its passage, There's going to be attempts to bolster it. Obviously, the more progressive side and the Democratic Party wants to see it, some wholesale expansions. But again, with the slim majority, it's going to be interesting to watch exactly how this will all play out. So, you know, that's a little bit on the political front, and we have covered all of this in our newsletters. Please make sure that you're still getting those and are keeping up to date. To turn our attention to COVID, of course, this has not gone away, and where we are with COVID. Our number one sort of discussion point at this juncture is vaccine administration. Of course, the federal partnership with Walgreens and CVS, it continues to take hold. Many have been vaccinated. I think what we're hearing from our members is that there's good news out there that the death rates are dropping, the outbreaks are dropping, but we're not out of the woods yet by any stretch of the imagination. And one of the things that we have been discussing with Capitol Hill and CMS and CDC is that there's this kind of view out there that you know, that they could have vaccinated nursing homes in sort of one stop, or you know, and that it's kind of a static population. You just go in, you vaccinate everybody, and then you leave, and our job's done. It's no secret to any of you, but obviously the nursing home is not a static population. We have staff turnover, we have residents and patients come and go, particularly on the post-acute care side where length of stay is actually not very great. So we have to remain vigilant about, you know, how do we continue vaccine administration? There's been a lot of conversations about continued partnership with local pharmacies and not just CVS and Walgreens. We've seen states like West Virginia that opted out of the federal program and have actually had some success. So we continue to stress that there needs to be flexibility, that nursing homes have a sort of an infrastructure in place and that requires some attention, and that you know, we need to provide them the flexibility to work with their local pharmacies and understand that the federal partnership, it was a good start, but we need to continue to vaccinate and have a plan to do so. Other issues, of course, now with vaccinations and sort of even the country beginning to reopen even more, with some states even removing mask mandates, although that's not the prevailing thought out there, is that how do we facilitate visitation? This has been a question for everybody. In our conversations with CMS, they view that their guidance back from September states that compassionate care visits are defined quite broadly. It's not just an end-of-life visit, and they actually encourage you know, visitation and to use that at your discretion. And that's kind of been sort of the thought out there, because there's a lot of pressure, and understandably so. If a loved one in a nursing home has been vaccinated and a family's been vaccinated, you know, why can't they go see them, right? At this point, does the cost of isolation, does the cost of not seeing their family for so long outweigh the risk? And I think this has always been a risk type calculation, risk reward type calculation. So, you know, I think at least in CMS's mind, at this juncture, there's nothing stopping necessarily visitation, but they are hearing from a lot of groups, particularly on the family consumer side, that want to resume. And, you know, we'll see if they will issue some updated guidance. We believe they will, but the timing of that is unclear. Meanwhile, you know, I think use your best judgment, and it has been the case all along. The other part we're talking about is the monoclonal antibody treatment. This has been proven to be, well, anecdotally, I shouldn't say proven given the lack of data, but anecdotally we're hearing that it has been successful, it is used well. There are challenges in terms of administration with staffing and other things. So we continue to talk with the federal government about the monoclonal antibody program. We do hear that many nursing homes are simply not aware of how to do it and how to go about it. So AMDA has held a number of webinars on the topic. So please check that out. If you're not sure how to get going, how to get started, please connect with us, and we are happy to provide you with our experts who have been working around the clock on this. Speaking of that, we do have actually some guidance that's going to be coming out on, as I mentioned, visitation and other issues. So please, again, look for our updates. Moving a little bit away from COVID, I want to mention that an issue that also came up at the end of the year, and I talked about on my last update, around the cuts to evaluation and management services in nursing homes. There was legislation at the end of the year to mitigate the cut. You are still facing a much smaller cut than you would have been without the legislation. But there's still, at the end of the year, they passed in the legislation, it delayed the impact of sequestration from a long time ago that is actually a 2% cut. You are scheduled to get a 2% cut if sequestration still goes into effect at the end of March, at the end of this month. There was a push to include in the COVID package relief until the end of the year from sequestration. It did not get included. There is separate legislation out there, and we provided you with some grassroots links to write your congressman and tell them that any cut right now especially would be devastating, whether it's 2% on top of already 1 to 1.5% cut that you've gotten. So this is an ongoing issue, and we'd love to have your support. As that's going on, we're also, as mentioned in several previous updates, are reevaluating nursing homes in the same way that the office-based codes were reevaluated. Right now, there's an ongoing survey. We sent it out to all of AMDA membership. Please look for your emails with a link to that survey. We stress that it is extraordinarily important that you take a look at that, and fill that out. Because there will be changes coming to evaluation and management services in nursing facilities. So please, again, if you have not received it and you're an AMDA member, please reach out to us and we can provide you with that link. I think those are sort of the major highlights as to what's been going on in the beginning of the year. Of course, we are, as of this recording, we're getting ready for our annual conference. You may be watching this during the annual conference. But we hope to see you at our virtual annual conference. There's going to be a lot of information, the latest updates on COVID, latest updates on payment policy and coding, and many other things. I probably skipped over a bunch of things in terms of how you can code and get paid for some of the vaccine administration and monoclonal treatment. So there's a lot of information out there to pack into sort of a short update. But please do follow us, and please to continue to ask us questions and stay engaged. Hope you all stay safe, and thanks again for all that you do. Thank you very much.
Hi, my name is Alex Bardakh, and welcome to AMDA on the Hill, your periodic update on our public policy efforts. It's been quite a bit since we last talked, so I want to update you on a few things that have happened over the last few months. First and foremost, the patient-driven payment model was implemented starting on October 1. It is now obviously at very early stages of implementation, and we have been in touch with the Center for Medicare and Medicaid Services to see how things have been going, and we welcome your feedback on how everything has been playing out in your world. We understand that CMS had a few glitches in terms of processing some of the claims, so if you've had any issues, please get in touch with us, and we would love to hear your feedback. CMS has reached out to us and wants to hear from us as to what they can do to fix a few things and figure out how to change anything that is going wrong in the future. We do have a lot of resources. If you're not familiar with PDPM, the new payment model for skilled nursing facilities, we do have a number of resources available, and they are referenced below the video and in the podcast. Please check those out and make sure that you're aware of what is going on and how you can participate as an attending physician, a medical director, a nurse practitioner, or anybody working in the skilled nursing facility setting. Second, the physician fee schedule final rule, which is the big regulation that comes out on an annual basis updating everything from physician payment to the quality payment program, was released in early November. AMDA has a summary of that rule. It is again included in the reference list below. So please take a look at that. There were a number of things that we have talked about over this year that were included in that rule. First of all, the CMS finalized its proposal for redoing the office-based evaluation and management codes. Essentially what they did was take the proposal that AMDA worked with the American Medical Association's RUC and CPT work group and accepted those values, which were higher than previous values for office-based codes. This was welcome news to the physician organizations and primary care. The other thing they finalized was some documentation changes, among them that you can now actually use the notes from NPs, medical students, PAs, in reviewing your history and physical. Just to note, and a reminder, that all of these changes do not go into effect until January of 2021. Typically, when CMS issues this final rule, it goes into effect January 1 of the following year. However, because of the substantial changes in this case, they are electing not to implement them until January 1 of 2021. The other question that I have gotten recently is whether or not this impacts skilled nursing facility evaluation and management coding. And the answer to that is no. The proposal that CMS finalized only impacts office-based codes. As to whether or not CMS will look at the rest of evaluation and management codes, including the skilled nursing facility, it remains a bit unclear what CMS plans to do. There was not much in the rule in terms of what they want to do moving forward, but AMDA has been speaking with the American Medical Associations and other organizations in terms of whether those changes will be implemented in the skilled nursing facility. Since there's going to be some time before all of this will be implemented, AMDA will have coverage of this, and there will be an upcoming webinar on billing and coding titled Billing and Coding, Something New, Something Old, and a lot of these changes will be covered there. So if you want to know information in detail of what CMS included in the final rule, I strongly urge you to check out that webinar. The other thing that this final rule covers is the quality payment program. And of course, the quality payment program was established to MACRA law and requires physicians to report on quality measures and also includes some cost measures and other categories. In somewhat of a surprise, but good news for post-acute and long-term care, CMS elected not to finalize its changes that they proposed to increase the cost measures that were included in the quality payment program. The cost measures are not very favorable to those practicing in post-acute and long-term care and lead to negative adjustments potentially. So we have lobbied and asked CMS not to increase the points that are allotted to that category, and CMS has listened to those requests and kept all the points for each of the categories in the quality payment program the same for next year. So essentially, everything that was true for 2019 reporting period will be exactly the same in 2020. This is something AMDA and other organizations have asked for, is to keep the program the same and not continuously change the program and change the values so that practices can catch up and implement changes they need to in order to be successful in the program. So again, that was a bit of good news for post-acute and long-term care. There were things that were not included, such as our asks around limitations on telehealth billing for skilled nursing facilities and some other things that we will continue to work with CMS. Moving on from the final rule, there was another announcement that came from CMS in early October and was implemented on October 23rd, and that is this icon, which looks like essentially a red hand, that CMS is putting on to the 5-star ratings on the Nursing Home Compare website. They announced this in early October, and it did not go through any rulemaking, and there was no comment period. Basically, what it does in a very short summary is it places a red hand to any facility, regardless of its star rating from 1 to 5, that may have had a citation for elder abuse citation. So what that means is all of you need to go back and check whether or not you have that and speak with your patients and your facilities as to what that means in terms of things moving forward. AMDA and many of the industry organizations responded to that, citing a lot of concerns about this, what it actually means, whether patients will understand this, whether hospitals that have preferred provider networks will understand this, and we will continue to speak to CMS as to how to perhaps make this so that they can implement their changes in terms of transparency, but not do things that actually harm access to care, which we think this actually has the potential of doing. Our letter will be publicly accessible, and hopefully we will provide a link to you so that you could read our public statement on this issue. If you were not aware of it, again, please go on your 5-star rating, put in your facility, and see if this was something that is up there. Those are just a few things that have occurred in the last couple months. Lastly, Congress continues to focus on nursing home quality and nursing home transparency, very much in line with what's going on with this icon. And they are actually holding a hearing on nursing home oversight, nursing home transparency, also some home health. And they will focus on issues such as antipsychotic use. Of course, that has been a point of hot debate around the CMS initiative. We have spoken to the committees of jurisdiction in Congress about this issue. And again, we have sent letters to them informing them of how AMDA has participated in the CMS initiative and what we have done to educate medical directors, attending physicians about the use of antipsychotics in nursing facilities. The summary of that hearing and potentially a video we will make available, and hopefully it is available in the link below for you. As always, if you have any questions, if you have any concerns, if you have any feedback on any of the topics that were covered, it was quite a bit of an update because it's been a little bit, so please email me. My contact information is included for you below. Please email me, let me know how everything is going. If you have any concerns with issues around antipsychotics, PDPM, the redhead icon, we value your feedback, we use your feedback, and as you can see, CMS does listen and it impacts actual policy. Again, thank you very much, and we'll be speaking shortly.